We believe in early detection of heart problems, cancer, diabetes, pretty much any health issue. But what about memory loss? Dr. Alan Lerner is here to share why our brain deserves better attention when memory issues first arise. Dr. Lerner is a neurologist with University Hospitals and the director of the Brain Health and Memory Center. Welcome to the show.
Thank you.
We're happy to have you.
Thank you.
Now, we tend to think that other people are going to notice our memory lapses and stuff, you know, more than we do, but you say that's not true.
It's not necessarily true. I mean, family members are very good at it because they're consciously comparing you to who you used to be. But we're also doing that. And so at least 50% of people who develop memory loss, they actually are the first person to know it before even a relative or certainly a friend might even have noticed any of it.
Okay, so how are they noticing?
It's usually the subtle things, forgetting names, particularly of people that they might have known for a long time through a church or workplace or something like that. Word finding problems, you know, the tip of the tongue. And to me, it's always a question of the pattern. Does it occur on a regular basis? Okay. There isn't anybody who hasn't made a wrong turn or forgotten an appointment or anything like that. And we know how bad that you feel when that happens.
You really do. So if you mention it to your doctor, a lot of times they kind of, I think, shrug it off. What should they be doing?
Well, they call it the worried well, and that's something of a patronizing term. If you think about the complaint of heart pain or chest pain, they give you a cardiogram, a stress test, they take
right
it
away.
Super seriously. Whereas if you complain of memory loss, they usually sort of pat you on the back and say, we're all getting older. And we really believe in a structured approach to it because the data suggests that many people who have this subjective memory loss years later may develop more severe problems, dementia, or Alzheimer's disease.
Okay, so what's the first step in making that determination?
The first step is to see whether there's any objective validity to it. Is there really a memory problem? And so a memory test, the kind of office test that is widely used, would be recommended.
Okay, what kind of things are tested on that?
Orientation, date and time and place, clock drawing, sentences, remembering words from a list, and generating words that belong to a certain category, such as animals or beginning with a specific letter.
Okay, so once the assessment is done, what happens next?
Depending on your level of concern, I think the physician should consider referral either to a geriatrician or a neurologist or possibly even a psychiatrist with some expertise in this area for additional testing, which might include things like CT scans or MRI scans. Okay,
so if you have a bad assessment, you got to move on and keep digging at it just like a heart doctor would, right?
I would consider it a pretty serious problem.
Now, I know that there's medications out there now that can help, it seems like can help with dementia. Is that also one of the treatment plans?
Usually not at this stage. I think the important thing is to understand it and we all should be involved in life planning. You don't wait for retirement to plan for retirement. If you had a memory problem now, you might begin to change your behavior in terms of your estate planning, your life expectancy, what is your important values, as well as this representing a baseline that we might be able to compare to 2 or 5 or 10 years down the road.
Okay, so is the incidence of dementia going up or down these days?
It's actually going down.
Well, that's a good thing, too. And if you catch it early, maybe you can kind of work with that.
Right. I think that the message about healthy lifestyle is actually catching on. Diet, exercise, control of diabetes and hypertension. These sort of mom and pop things are more important than the rocket science approach to this problem.
All right. Great information here for us. Your brain matters. So make sure you mention memory issues to your physician, and if necessary, insist on an assessment for early detection. My thanks to Dr. Lerner for such memorable information.
Thank you very much, Lori.
Thanks.
Learn more by calling University Hospitals at 1-844-312-LIFE or visit their website, www.uhhospitals.org.